good afternoon. Welcome again to Munge Farm. Today my fellow farmers, the intention was to talk about the common diseases in this area with our animals, that is the cows, the sheep and the goats. But as we came in, we find ourselves lucky. For this week, 9 goat kids. But right now, just as we came in, we found this young girl. She's a girl. I think this is her third birth. Has just given to two of these kids. This is a female, and the other one is a male. One female, one male. So this is the reward we have gotten this week. This is the second week of April. Today it's 14th April 2025. So the 3 weeks ago we had about 30 of these. Ours is not synchronized, so it's free range. So they do it at their own wish and at time. But this week alone, this week of now we have 8 out there and 2 of these. So today this girl gives us now 10 kids, and we are so lucky. So I want to introduce to you a common daily vet who looks at these animals, and he will say his name. What's your name?
Well, my name's Julius Nderito.
Julius Nderito.
I'm a vet assistant by profession.
Trained where?
Trained at Ahiti Domba.
Ahiti Domba.
Yeah. I do practice my work here.
He practices here.
As a vet assistant, I've catered for this for around 2 years now.
He's been in this farm for 2 years.
Yeah.
So.
And I've seen great improvement, by the way.
I would agree with that.
Yeah.
One thing, before even we go through the video, I want to praise him for one. He's very consistent. Anytime I make a call, he's quick to catch a doodie or whatever transport there is and run to the farm. And one thing I've learned also with my small 2-year experience with animals, that the speed of attention, the herder's eye, what the herder is supposed to report, how quickly the herder reports is what matters. Because that's the short time you take to treat. That the treatment is effective depending on how long it took to, and he would say that. Now, our topic today is the common diseases in Yata for animals. Chalo. Tutabie.
Tongo.
Eka diokia.
Eka dioka.
Eka dioko.
Eka dioka.
Na nekana.
Nekana.
Kalianza lini? Kambie.
Kambie dioke tongo tene. Akile badira nuna tonya tingano.
Nekatonyo sina.
Kana tonya batingano.
Siko ziana.
Tingano omwe.
Okay.
So now let's hear from the vet what happens.
Alinipigia, then akanielezea mzuri inaenda kama there is another goat that was behaving the same way.
What is the disease?
The disease comes in the central nervous system.
Is the central nervous system?
Yeah. It makes the goat to lose balance.
From here?
Between the ears.
Between the ears.
So the causes are very different. It might be.
So this is our main man. This is the herder. He's been herding these animals for the last 1.5 years. Why it's important to have a clever or an attentive herder is because he's the first person to identify 1, a sick goat, 2, a missing goat, 3, a sick cow, a missing cow, any abnormalities within the animal setup. He's the first person to. So let him say his name.
Mimi naitwa Sami Mutuko Ndonda.
Sami Mutuko Ndonda.
Kwetu ni Mbiuni. Kadama. Area ya Orani. Utitini sub location. Mimi nachunga ng'ombe, mbuzi, kondoo katika area ya Okay, niko hapa kukake karibu miaka kadhaa na miezi. Kwa hivyo naendelea tu na kuchunga.
So wewe ndiye anaangalia ile inaenda polepole kwa herd. Hiyo ndio unaangalia vitu gani ndio ujue kuna shida?
Naangalia ng'ombe, wanyama.
Ndio ujue kuna shida, unaangalia ndio.
Ikiwa na shida naona ngozi yake inapinduka.
Ngozi inapinduka?
Haya. Mapua natoa nini?
Mapua natoa?
Makamasi.
Kama
ile inaenda mguu mbaya.
Ile inaenda mguu mbaya, hiyo inaweza kuwa ni kugongo ama tik.
Ile inakuwa sikilebu kuenda kwake, najua
ile inaenda polepole. Kwa hivyo ile iko nyuma.
Iko nyuma.
Na ikuangi nyuma kawaida.
Ikuangi nyuma kawaida. Angalia hiyo ni mgonjwa. Dawa natafutwa.
Alafu unaangalia
ngozi. Ikiwa inapindua rangi. Inainua hii manyoya yake.
Kuinua manyoya?
Hiyo naona ni mbaya kwa mwili yake. Kuna shida. Namna hiyo.
Endo kune? Siuke ba. Endo kune siuke. So Wachira, take over now. Tell us.
Okay.
What he's saying about fire. You can interpret what he said to.
As I have already said that we are in the ecological zone 4. That is between. In ecological zone 4, that is between arid and semi-arid areas, and they are the common diseases that are common here, especially in goats. That is, there are two major infections that affect the goats. That is the respiratory disorder and the so-called the hygienic diseases that are caused by lack of enough cleanliness in the herds. That is, they are caused by bacterial infections and they are also treatable. Well, as I have earlier said that the respiratory disorder is the ones that we cater for most of the times when I come here, because the environment is not very. The environment does not favor these goods so much because there is a change of weather. Then the other issue is the routine management we do after every 3 months. That is deworming and administering multivitamins to keep them fit and build their immunity. The other thing is, let's move to the cows, is about, there are 3 different diseases that affect the cows mostly, and they are tick-borne diseases. That is the East Coast fever, the anaplasmosis, and there is the so-called trypanosomiasis caused by fly, or the ones that it is commonly known as sleeping sickness, but the botanical name is trypanosomiasis. Now with ECF, which is the East Coast fever, it is caused by a certain tick called the Rhipicephalus appendiculatus, and it is very common here. So the only thing we do is to rush when analisha akidetect these lymph nodes kama zimefura, huwa wana,
that is
the guy, there are 6 of them. Kwa masikio
guy
here, hapa
then here,
yeah. Akinotice hivi kuna there are swollen lymph nodes, lazima contact the farm manager who is tunamuitaga pastor. Then pastor ananipigia simu na kuja haraka iwezekanavyo, so that the more I attend the more I attend in a fast manner, the more inakuwaga na chances.
The speed of attention.
Yeah.
The speed you give the animal attention really matters.
It really matters because
the disease will not have gone so far in terms of
attacking. Yeah. Then
so you can turn and show the animals.
Yeah. There is this other disease. There is this other disease called anaplasmosis. The so-called in a local language we call it digana.
Digana.
Nagana.
Digana.
It affects the digestive system of the cow, and it is also treatable. So, and we do treat with oxytetracyclines, and there is, and it hardens the stool
of the animal.
So we apply the so-called Epsom salt. But with the East Coast fever, we do treat with a drug called bipavaquone or Butalex. Those are the common drugs that treat the East Coast fever.
I want us to discuss a few animals. Okay.
Okay.